Yes. Why I left nursing. Yes. I know I've been forced to give up work at the psychiatric department, but I gave up nursing quite a while before I was forced to give up work. I worked for a while in a call centre in Pontins for quite a while, and I kept trying to leave, but the truth is I couldn't find enough job to keep me in the style to which I was accustomed. Nurses keep going on about they're impoverished. I could not find a job, even advertised in the paper anywhere, that I could apply for that was paying me as much money when I was a nurse. And why I left nursing, yes. Brookhall, the asylum that I worked at, closed, and I got a job working for various nursing agencies and social services. I was visiting, the asylums that closed. They were, when I was at the asylum, they used to say mental handicap. Social workers have renamed this group of people with learning difficulties. Now, I was going into the homes, and they used to walk in, and they'd all stare at me. I could see the anger and resentment in their eyes, and I said, "Look, do you not want me in your house?" And one of them would pipe up, "We can cope on our own, I said, "I know that, but I've been sent here to help you. They said you're not cleaning up good enough." Now, I'm not very good at cleaning, but I'll try to make a better job than you have. And if they don't send me, they'll only send somebody else. I said, "Now, is there anything I can do for you? What do you want me to do?" And one of them piped up, "Well, a staff bought me a video, but she won't let me watch it. Can I watch it while you're on duty?" I said, "Yes." "Oh, right. Sit and watch this video with me." I said, "Yes." I said, "Now, the main reason I've been sent is to make you tea. Do you want me to make you tea? Or can you make your own?" I said, "Oh, well, we can make our own, but go on, we'll let you make it. We like your cooking, Amanda. Most staff give us all dry steam stuff. You always make gravy or a sauce." I said, "Oh, all right. I'll make you tea." And I realised that once people have had experience of being looked after by another person, they soon start wishing that people would just leave them alone to die on a bed if necessary. And I've experienced that myself. These nurses think they're helping, come round to your house, and they have a need to feel useful in life. When I was on injections, they feel useful. They're giving me an injection. Now, I've gone back on tablets on my own request because I'm scared of needles. Now, I know from experience that when I'm on tablets, they don't know what to do for me. They feel like they have to do something else other than deliver their tablets. So they'll sit and interrogate me for 20 minutes. Whereas when I'm on the injections, they don't ask me anything, they just inject me and disappear. Feel like they have to interrogate me for 20 minutes to feel like they're fulfilling the job description. Then they always say, is there anything we can do for you? I think, well, they feel like they want to be useful. What can they do for me? I've got a pile of ironing in there. If you want to iron for me, I hate ironing. And then they laugh and say, I hate doing my own ironing. No thanks. Good try, Amanda. So, do you want to push the hoover around for me? Nice try, Amanda. So what do you want to do for me? Apart from taking me for a brew. I don't like going out with nurses for a brew. I told you that. And say, do you want us to read your mail? I said, look, I know you nurses don't understand, but I haven't forgotten how to read because I've been diagnosed with a mental health problem. Can read my own letters. Well, maybe we could help them sort them out better than you can sort them out yourself. So what do you mean? Liv, you're getting in debt. I'm not getting in any debt. I'm quite good at managing my money. And you know, it is annoying when the authorities send somebody around to your house. You know, I know when I was working in disability, well, in these patients' homes, when I was working in them myself, there were sort of two categories of staff. There were those who believed that patients were incapable of anything, and therefore they did everything for them. And then there were those who thought that the patient should be encouraged to do everything for themselves, and they ordered them about and then shouted at them when they weren't doing it right. Now, I was sort of in between. I used to ask them what, you know, I used to say, do you want to do it yourself or do you want me to do it? Now, other staff used to complain that they couldn't tell whether I'd done it or whether the patients had done it. Yes, I know, I'm rubbish at housework and ironing, I know. This is what the psychiatrist can't get the head round, why I'm no good at housework when I've got breasts. Women are supposed to inherit a good housework gene or something, aren't they? You know. Yes. That's why I left nursing. I become totally disillusioned with it. I could feel, you know, these people don't want anybody in their house looking after them. They want to cope for themselves the best they can, even if they do get into difficulty, you know. And you know, I used to have problems with patients. I used to say, you don't want me here, do you? And they say, no, quite frankly. And I say, well, if you don't send me, I'll only send somebody else. Now, what do you want me to do for you? And if they said, will you do me ironing? I used to do the ironing. I used to say to them, well, okay, I probably won't do it any better than you, though, because I'm rubbish at ironing. I used to try my best to do the ironing for them, or whatever they wanted me to do. You know, because I went into nursing to help people. And usually after I've been working with them for a couple of months, they'd say, I've changed my mind about you, Amanda, you're alright, I like you. you know. None of the staff liked me. Used to think I was too soft with the patients. I think that's why they've had me redesignated as a patient, a psychiatric department, so everybody can see whose side I'm on. Yes, another thing I never got in nursing, and I'm not saying all the nurses have a crap sense of humour. You know, I remember even at Brockhall, and I used to like most of the staff at Brockhall. I was appalled, actually. These two nurses, I thought I liked them. I wasn't sure I liked them. They weren't good friends of mine or anything. They were only acquaintances that I'd talked to occasionally. But they were in the staff club. And they were rolling over, laughing. They were clutching their stomachs. They were coughing and spluttering. So I walked up to them and said, "What's the joke? I like a good joke. Well, I like a good laugh." Well, you know me. I'm always taking the piss out of everybody, aren't I? And you never believe what a patient said to me today. I said, "What?" Can't remember what I said to her first. It was just something a bit flippant or something. I said, "Yes, go on." She said to me, "Get this, you're paid to look after me." I said, "Well, what's funny about that? You are paid to look after her." And they both looked at me and burst out laughing and said, "Amanda, you're as bad as the patients." Ha 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 ha. So I'm sorry, I don't get the joke. I don't find that funny. Well, get this. Then she said, if it wasn't for the patients in this hospital, you wouldn't get paid. If there wasn't any patients, you wouldn't get paid. And then they both started hysterically laughing again. But what's wrong with that statement? That's true. What's funny about that? You know, I was on the psychiatric ward in Chorley, and I overheard. I'm very nosy. I listen to the staff's conversations when I can. You know, this community nurse was talking to one of the inpatient staff, and he was laughing. And he said, "I've been round to," now I can't remember his name now, which name he said, and if I could remember it I won't repeat it. Yeah, "I've been round to such and such a body's house to take him swimming. And he said to me, 'Do you go swimming in your spare time?' And I said to him, 'No, of course not.' He said, 'Do you go temping bowling in your spare time?' I said, 'No, of course not.' He said, 'Do you go paintballing in your spare time?' 'No, of course not.' He said, 'Well, what do you do in your spare time?' He said, 'Well, I'm working. I don't get much spare time. I usually go out for a drink with my wife a couple of nights a week, and then we stay in and watch telly the rest of the week.' And the patient said, 'Oh, you live a nice boring life.' At which point they both hysterically started laughing and clutching their stomachs. Now, you know, I was overhearing this. I think that's the patient's way of telling you that he doesn't enjoy going swimming and paintballing and temping bowling. At which point they start hysterically laughing at me. "Yes, Amanda, we know you're a joker. Go away." That's why I left the nursing profession. Yes.